Assalamualaikum warahmatullahi wabarakatuh. My name is Khaleeda, and today our group will be presenting on the medical series Grey's Anatomy for our video critique. And the next slide will be our group members. Firstly, as for the synopsis, Grey's Anatomy is a popular American medical drama series created by Shonda Rhimes. The show premiered in 2005 and has become one of the longest-running medical dramas in television history. Set at the Gray Sloan Memorial Hospital in Seattle, the series follows the personal and professional lives of surgical interns, residents, and attending physicians. The central character, Meredith Grey, navigates the challenges of her medical career while forming close relationships with her colleagues. The show delves into the complexities of medicine, ethical dilemmas, and the emotional journeys of the characters. Throughout its seasons, Grey's Anatomy explores love, loss, friendship, and the ever-evolving dynamics within the hospital. The series is known for its emotional storytelling, diverse ensemble cast, and its ability to tackle both medical and personal narratives. So, now we will move on to the first critical incident.
This is not about the Weber method, Bailey. It's about one surgeon who overstepped. If we cancel the GC method, every time a surgeon made a mistake,
A preventable mistake. It was preventable. I am suspending the Weber method immediately and indefinitely.
You absolutely will not. I won't accept it. You may be the chief of this hospital, but I'm the chief of chiefs.
Good board, Richard. You want to pull rank on me? I will report you.
Bailey!
You should have been an attending in that room. I'm done arguing.
Smith, stop wasting water. Your hands are clean.
The first scene showed a negative communication where Dr. Weber had a heated argument with Dr. Bailey, who is trying to suspend the Weber method immediately when Surgeon Schmidt, a surgical resident, failed to save his patient. Dr. Weber tried to prevent Dr. Bailey from suspending the method when he said that it is not the method that is at fault, but the one surgeon who overstepped himself. The scene is related to confrontational communication, whereas it tends to anger, create unnecessary conflict, and damage relationships at work. This argument is caused by Surgeon Schmidt failing to save his patient, Devin Gomez, when he started dissection without waiting for the attending general surgeon to arrive at the operating room. He failed to listen to his subordinate, which resulted in the death of his patient through excessive loss of blood. From this scene, we can conclude that as superiors, both parties should practice professionalism by applying cooperative communication when communicating with each other.
Schmidt, I'm in the middle of...
It's my mom. Oh, God. Mom, stay with me. She fell down the stairs. Ambulance is taking forever to get here.
Vic, talk to me. Did you find...
I found a knife.
Can you sterilize it with something?
Yes, I have alcohol wipes.
Schmidt.
Dr. Weber, I don't think that I can stab my mom with a knife.
It is not a knife, it is a makeshift scalpel. And you're not stabbing her. She is a patient who needs a thoracostomy. I've seen you do dozens of them.
Okay. Okay. I'm sorry, Mom. All right. All I have are some little scissors to get into the chest wall.
Okay, that'll do.
All right, I'm in. Okay, she's breathing better now.
Nice job, Schmidt.
Oh my God. Oh no. Oh my God.
What is it?
It's a hemopneumothorax, not just a tension pneumo.
Schmidt, I need you to stay calm.
Seattle Fire Department.
They got him down here!
As for the second scene, we can see that it is a positive communication. Dr. Schmidt reached out for help to Dr. Weber when his mom slipped and fell down a flight of stairs, causing her to lose consciousness. He had to do an emergency thoracostomy guided by Dr. Weber through a phone call. Dr. Weber comforted and reassured Schmidt when he doubted himself by saying, "I have seen you do dozens of them," when he was reminded of the trauma from his last patient. The theory that is related to the scene is minimizing barriers in communication, where they did not communicate face-to-face, but through a phone call. The effect of this scene is Schmidt successfully performed an emergency thoracostomy on his mom, which resulted in her breathing better before the paramedics got to the scene. As a recommendation, they could establish clear communication channels within the workplace. This could involve a designated emergency hotlines or protocols for seeking immediate guidance in critical situations. It is advised to implement training programs or workshops focusing on effective communication during high-stress situations.
Meredith Grey.
Catherine, I can't do this right
You
now.
would leave this place right in the
Catherine?
middle. Do not interrupt me.
Please don't talk to her that way. You are not her boss, nor are you mine.
Boss.
Excuse
This
you?
is about honor. This is about the standing of this hospital.
Okay,
the
can we
standing
not
of
do
this
this? Can we
foundation.
just stop for a minute? A woman just lost her pregnancy. A pregnancy that she fought for with everything that she had left in her body, through grief, through pain, through loss. She fought and she lost her pregnancy. Can we just take a moment and honor her? Just a moment to honor Tova.
It can be seen that the third scene is an example of negative communication when Dr. Montgomery raised her voice to Dr. Fox, begging her to convert Meredith somewhere else to respect the patient, Tova, who just lost her 11 weeks old pregnancy. When she said, "Can we just stop for a minute? A woman just lost her pregnancy. Can we just take a moment to honor her?" in a frustrated voice. The theory related to the scene is confrontational communication and simultaneous talk, which involves language that demeans and often employed as measures of dominance. The effect of the scene is that Dr. Fox, Weber, and Gray were all left speechless. As a recommendation, one should clearly outline appropriate behavior and communication guidelines, emphasizing the importance of professionalism and patient-centered care. Mainly the superiors, as they need to set a good example to their subordinates.
Everything was dry, and the field was clean. So I asked for the GIA stapler.
But there was no indication of any abnormal anatomy or friable structures, right? That you could see, I mean.
What?
Meaning, you couldn't have predicted that the aorta was congested.
This is just the best. Yeah, I'm gonna stay here a while, you guys.
It was an unanticipated complication.
Is there a question in there somewhere, Hal? I didn't think so. Schmidt, go.
That was the field filled with blood, and You're Devin Gomez. Never knew I had a groupie. It's nice to meet you, Dr. Schmidt.
Schmidt, call it.
I killed him. I killed him. He's dead.
Dr. Schmidt, look, we are here. Dr. Schmidt, no, we are here to determine what happened and how.
Assalamualaikum and hi, my name is Fazlina, which I will be presenting another 3 scenes, whereby in this scene shows about a group discussion in which Dr. Smith needs to give a talk in the morbidity and mortality conference regarding the failure surgery due to the Weber method that he did for a better improvement for the next surgery. But he is stressed out and escaped from the room after being questioned by the other workers. Then the discussion needs to be continued, whereby Dr. Weber took over the question from the residents and seasoned surgeons. But the discussion between the surgeons turns out to be chaotic. It is because the discussion of the surgery error that was made by Dr. Smith become hanging, and there is no problem solving from the superior too. Therefore, to be a professional worker, we need to have the courage to face in this situation, even though we are at the bottom. The group discussion also must to be continued for a better improvement in the working place at the end.
You publicly humiliated me in the hospital where I've worked for over 30 years.
That was not my intention. I was just trying to do my job. I took an oath.
I took the same damn oath. Schmidt didn't make a mistake. Schmidt made a decision. Okay, he chose to subvert my teaching method. He chose to proceed without waiting. And then somehow you went after me?
I believe in systems, okay? I believe in scientific data of running scenarios multiple times to ensure they work before we implement new procedures. And I don't believe that we have done that here.
We? Who is we, Maggie? You haven't been here. Neither has Meredith. So neither of you get an opinion. So please, leave me alone before I say something that I'll regret.
The next scene shows that to the critical dialogue, and then somehow you went after me, Dr. Weber said. When Dr. Weber got mad with his colleague, Dr. Pierce, that humiliating him during their M&M conference, he could not accept advice that Dr. Pierce said to him and drive away Dr. Pierce with the fierce tone. This is because Dr. Weber needs to take responsibility for how to overcome the steering error that done by his co-worker Dr. Smith, who is new in this field, and push him to use the Weber method that he's created. Then Dr. Weber ended up being stressed, and he wants space to be alone in the room to think about his problem that he's facing. The test that he get will make him more worried about the issue. However, to be a good superior at the workplace, we need to control our emotion when dealing with co-workers, and it will lead us to avoid getting mad and easy to solve our problem truly.
Are these your residents?
Hi.
Ms. Blake, I am sure you are aware that the state, the entire country for that matter, has been experiencing a serious blood shortage. So we decided to take matters into our own hands.
By making your residents donate blood during a shift.
This is entirely voluntary. Well, you gonna shut us down for a nationwide problem?
For the sixth scene, it's shown cooperative communication between Dr. Bailey and Miss Blake, which Dr. Bailey just being responsible and try to talk to Miss Blake, who in charge to investigate the residency program in the hospital. Based on the critical dialogue, are you gonna shut us down for a white nation problem? Dr. Bailey said, which point out she's being cooperative to help the residents by convincing Miss Blake for not reporting to take down the hospital residency program due to the problem that they face. The problem is that the hospital has shortage blood, which the residents need to obey by their superior's order to donate blood during working hours. In fact, Dr. Bailey stand up with her point to protect their resident program and the hospital from being closed just because of the one reason which residents donate their blood during the shift, so that working flow will be run smoothly and there will be no tense or stress if their teamwork is good. Hence, to handle a critical situation, it is vital for superior to be cooperative and protect their subordinate from getting expelled or suspended in the working place when they have in a critical situation. Okay, that's all from me. Thank you.
Shepard, syringes are locked and loaded.
Owen is my patient. He could be suffering a complication from a procedure that I've already done on him.
Are you seriously considering leaving this room?
Tom knows the procedure as well as I do.
Amelia.
Fact.
Meredith, it's Owen.
No, it cannot be you. If you were to walk out of here right now, we will lose the FDA approval, the funding will stop, and this whole thing would have been for nothing.
Hi and Assalamualaikum. My name is Fatihah Binti Aziz and I will be presenting the last three scenes. In the first scene that I chose, the main event is about the groundbreaking cell therapy surgery on Dr. Hamilton. Meredith, Emilia and Kai have been preparing for this day for a long time. The surgery goes smoothly until the exact moment where Emilia is about to inject the cells into Hamilton's brain. She gets paged because Owen, her patient, is leaking spinal fluid and has been rushed into the OR. Amelia hesitates for a moment, deciding whether she wants to walk away from the surgery to help Owen. This demonstrates cooperative communication from the theorist that Dr. Shepard's professionalism by controlling her emotions because the other doctor is pressuring her. Dr. Shepard was not in a hurry to go to the patient. Instead, she asked Meredith for opinion whether to go or not. This is because she felt responsible for her patient. Her patient might be suffering a complication from her procedure that she already did on him. It is critical for Dr. Shepard as a professional neurosurgeon, while doing an important surgery, to maintain emotional control, make a fast decision even under pressure, and show professionalism while on duty. Because of Meredith's advice to Dr. Shepard to not go to her patient, the surgery went well. The Grey Sloan Memorial Hospital will have the FDA approval and will continue to have funding. Therefore, it is highly recommended to maintain professionalism in the workplace to avoid any unnecessary disturbance and misunderstanding.
Patient's name?
Arthur Kayat, 21. End-stage liver disease secondary to primary sclerosing cholangitis. Patient's getting orthotopic liver transplant today.
Good. Donor's name? Donor's name? James. His name is James. You know, I've stood next to 100 different doctors waiting in line to retrieve organs, and that's what it is to a lot of them. An organ that will help save their patient. But it's not just an organ, is it? Is it somebody's life, somebody's brother, somebody's child? It's the greatest gift a human being can give to another human being. And if you want to be a great transplant surgeon, can't forget that. You cannot forget the person who gave the gifts. Okay? We're ready. Scalpel, please.
Regarding this scene, it is about Dr. Nick has a young patient named Arthur who has been on the liver transplant list for 137 days, and finally they found him a liver. Before the surgery begins, he decides to go out into the waiting room and talk to their family about their son. They tearfully tell Nick about how they love James, and Nick tells them that he will be thinking about James while he operates. And during that scene, it shows that Dr. Nick asked Dr. Lee about the donor's name, but he couldn't answer it. So he advised nicely to Dr. Lee to remember the donor's name, because to him, many other doctors just think that organ is just an organ, but not to him. He reminds his colleague that an organ is the greatest gift from one human being to another. And if he wants to be a great transplant surgeon, he cannot forget that advice. In this scene, Dr. Nick reflects an assertive style of communication. Based on the assertive communication theories that I have learned, Dr. Nick Marsh advised Dr. Lee in a polite manner, in which he told him to remember donor's name before starting to operate on a patient in the OR. As Dr. Lee are willing and agree to listen to the advice, he might be comfortable working together with Dr. Nick, which results in better performance since he is accepting Dr. Nick's advice to appreciate the donor's gift. Hence, when working together, it is important to use assertive communication among employees to build a professional and effective working environment.
I want to teach. Multiple paths exist to save lives. Schmidt, you belong on one of them. Come back. You and I can find our way together. A new way.
I appreciate you coming here, Dr. Weber, trying to salvage my career, rescue me. But you're too late. I've already bled out. There's nothing left to save.
Based on this scene, Schmidt is still holed up in his mom's basement, playing a violent video game non-stop. He explains to Weber, who can understand how Schmidt is not bored of it, that in that video game, when he makes a mistake, he gets a do-over. Nothing about his situation is healthy, and Weber tries to snap him out of it and tries to connect with Schmidt by relaying his own story. When Weber also tries his best to tie those video game sentiments to medicine, that Schmidt can learn from this, and armed with his experience and skills, he can choose to try again or choose a new path within the medicine. But it's kind of a stretch. Schmidt responds that he doesn't want to hear it. He thanks Weber for trying to rescue him but tells him it's pointless, that he is already bled out. There's nothing left to say. Schmidt reveals very poor ethics and unprofessional behavior. Based on the conventional communication theories, it is inappropriate if we are not listening to advice from another worker, especially when they try to confront us. Therefore, Schmidt responds, leaving Weber speechless. So, this will affect their relationship. His response also reflects a lack of respect for his superior. It is very important to have such a nice superior like Weber because he did not give up on giving his advice to anyone who is demotivated, such as Schmidt. In conclusion, the critical incident highlights the importance of cooperation, style, and personality in effective communication. These elements significantly impact the relationship between leaders and co-workers. And additionally, having a great personality creates a comfortable working environment by reducing communication barriers among employees. Furthermore, showing good cooperation and actively listening to the ideas of the others is crucial in making them feel appreciated and respected. Finally, these communication tools should be applied to everyone to ensure a stress-free working environment.